What home health care does Medicare cover? Assuming you meet all requirements for the Home Medical Advantage, federal medical care covers the accompanying. Gifted nursing administrations, administrations performed by or under the management of an authorized or guaranteed medical caretaker to treat your physical issue or sickness. Administrations you might get incorporate infusions, and instructing you to self-infuse, tube feedings, catheter changes, perception and appraisal of your condition, the executives and assessment of your consideration plan, and wound care. Given as long as 7 days of the week, for the most part something like 8 hours out of every day and 28 hours of the week. In certain conditions, federal medical insurance can conceal to 35 hours out of each week. Gifted treatment administrations, physical, discourse, and word-related treatment benefits that are sensible and fundamental for treating your sickness or injury, and performed by or under the oversight of an authorized specialist. Non-intrusive treatment incorporates step preparing and oversight of and preparing for activities to recapture development and strength in a body region. Discourse language pathology administrations incorporate activities to recapture and reinforce discourse and language abilities. Word-related treatment assists you with recovering the capacity to do regular day-to-day exercises without help from anyone else, like eating and getting into garments. Home well-being assistant, federal medical care forks over the required funds for a helper in the event that you require gifted care, talented nursing or treatment administrations. A home well-being associate gives individual consideration administrations, incorporating assist with washing, toileting, and dressing. Government medical care won't pay for an associate in the event that you just require individual consideration and don't require talented consideration. Clinical social administrations, government medical care forks over the required funds for administrations requested by your PCP to assist you with social and profound worries you have connected with your disease. This might incorporate directing or help tracking down assets locally. Clinical supplies, federal medical care comes up with all required funds for specific clinical supplies, like injury dressings and catheters, when given by a government medical care confirmed home well-being office, HHA. Strong clinical hardware, DME federal medical care pays 80% of its supported sum for specific bits of clinical gear, like a wheelchair or walker. You pay 20% coinsurance, in addition to up to 15% more on the off chance that your home well-being organization doesn't take task. Federal health care ought to pay for these administrations whether or not your condition is brief or ongoing. Note, you can't fit the bill for federal medical care home well-being inclusion in the event that you just need word-related treatment. Notwithstanding, assuming that you fit the bill for home medical care on another premise, you can likewise seek word-related treatment. At the point when your other home well-being needs end, you can keep getting federal medical care covered word-related treatment under the Home Medical Advantage on the off chance that you really want it. Federal Medical Care's Home Medical Advantage doesn't cover all home consideration administrations. Administrations prohibited from government medical care inclusion include 24-hour out of each day care at home, physician-recommended drugs. Assuming you want professionally prescribed drug inclusion, sign up for a Section D arrangement or a government medical care benefit plan that gives drug inclusion. Dinners conveyed to your home. Custodial consideration, homemaker administrations, including light housekeeping, clothing, and dinner arrangement. Home well-being associates might play out some custodial consideration while visiting to give other well-being-related administrations. In any case, assistants can't visit with the sole motivation behind performing custodial obligations. Assuming that you are critically ill, federal medical insurance might cover a portion of the above administrations and things in the event that you choose the hospice benefit. All government medical care benefit plans should give essentially a similar degree of home medical care as unique federal medical insurance, yet they might force various principles, limitations, and expenses. Contingent upon your arrangement, you might have to get care from a home well-being office, HHA, that agreements with your arrangement. Demand earlier approval or a reference prior to getting home medical care. Pay a co-payment for your consideration. Unique government medical care completely covers home well-being. Realize that HHAs can pick who to acknowledge as a patient or decline to give you home well-being administrations in the event that they don't really accept that they can guarantee your security. In the event that no HHA in your arrangements organization will accept you as a patient, call your arrangement. Your arrangement should give you home medical services assuming your primary care physician says it is restoratively fundamental. Assuming no in-network HHA will give it a second thought, however an out-of-network HHA will, your arrangement should give inclusion to your out-of-network home medical care. On the off chance that no HHA in your space can furnish you with care, address your PCP about different choices for getting care. In the event that you really want data about the expenses and inclusion rules for home medical care, or on the other hand assuming you are encountering issues, contact your federal medical care benefit plan. Before you get federal medical care covered home medical services, your home well-being organization, HHA, ought to survey your condition to make an arrangement of care. For the most part, your arrangement of care will list the kinds of well-being administrations and things you really want, how frequently you will get administrations, the anticipated results of treatment. Your PCP should sign the arrangement of care toward the beginning of your consideration or not long after it begins. The arrangement of care is frequently matched with the home well-being affirmation structure that your PCP should sign to show you want care. Whenever your PCP first ensures your qualification for home medical services, you should have an eye-to-eye meeting to examine the explanation you really want care. This gathering should happen inside the 90 days before you start care or the 30 days after the main day you get care. Your underlying arrangement of care and affirmation will be the most recent 60 days. In the event that you want extra consideration, the affirmation and plan of care can be recharged for however many 60-day timeframes as needs be, as long as your PCP keeps on marking them. Ensure that your PCP concurs with the arrangement of care and thinks it contains all the consideration you want. An up-close and personal gathering isn't needed for recertification. Government Medical Care's Home Medical Advantage covers talented nursing care and home well-being assistant administrations as long as 7 days out of each week for close to 8 hours of the day and 28 hours out of every week. In the event that you really want extra consideration, government medical care gives as long as 35 hours of the week dependent upon the situation. You can keep on getting home medical care however long you qualify. In any case, your arrangement of care should be recertified like clockwork by your PCP. Your PCP might make changes to the hours you are getting or different administrations, contingent upon whether the degree of care you are getting is as yet sensible and vital. Federal Medical Care's Home Medical Advantage covers gifted nursing care and home well-being assistant administrations gave as long as 7 days out of each week for somewhere in the ballpark of 8 hours of the day and 28 hours out of every week. On the off chance that you want extra consideration, federal health care gives as long as 35 hours out of each week dependent upon the situation. You can keep on getting home medical services however long you qualify. Nonetheless, your arrangement of care should be recertified at regular intervals by your PCP. Your PCP might make changes to the hours you are getting or different administrations, contingent upon whether the degree of care you are getting is as yet sensible and essential. The cycle for beginning the Federal Medical Care Home Medical Advantage changes, relying upon whether you are as of now in a clinic or on the other hand in the event that you are as of now at home. Keep in mind, in the two cases you should meet the qualification prerequisites and fit the bill for inclusion under either Section N or Part B. In the event that you are in the clinic, a medical clinic social laborer or release organizer ought to set up for a Federal Medical Care Confirmed Home Wellbeing Office, HHA, to visit you and evaluate your condition. Assuming you qualify, you ought to get home medical care subsequent to being released. On the off chance that you are at home or leaving a SNF, address your primary care physician about your home well-being needs and request a rundown of federal medical insurance guaranteed HHAs. You, your PCP, or a parental figure ought to have the option to call a HHA straightforwardly and request that they visit your home and survey your condition. You ought to likewise have the option to find nearby HHAs through your clinic release arranging office, 1-800-FEDERAL Health Insurance, or the Elder Care Finder. Regardless, the HHA ought to assess your home well-being needs and make an arrangement of care. Your PCP should ensure that you fit the bill for Government Medical Care's Home Medical Advantage, approve the arrangement of care, and recertify the arrangement at regular intervals.